All right, I think we have 221 people right now, so people continue to enter. We're going to start today's webinar. Good afternoon and welcome everybody to our first NLAAD 2020 webinar. I am Luis Mares. I am the Director of Community Mobilization Programs at the Latino Commission on AIDS. I'm sorry, okay. And I'm the organizer of the NLAAD campaign since 2017. We're very excited to start this year's series of webinars with a topic of great importance these days, specifically as it is HIV testing during the COVID-19 epidemic. As we know, the COVID-19 pandemic has made it more difficult to access traditional places where testing is provided, such as clinics, hospitals, community-based organizations, and healthcare settings. Yet, the benefits of knowing HIV status continue being so important, including improved health and prevention. In many places, HIV testing that requires face-to-face contact has been scaled back or suspended because of the COVID-19 pandemic response. As a result of the social distancing measures due to COVID-19, the number of HIV tested has fallen nationally. Because of this, HIV Self Testing programs can supplement the HIV prevention efforts of health departments and community-based organizations, which are encouraged to provide the residents and clients with self-test kits and have them shipped to their homes or other locations, and if the test is positive, information about linkage to care should be provided. The CDC encourages people at risk for HIV infection to get tested in ways that are in compliance with stay-at-home orders and social distancing practices, including self-testing. This webinar today is presented as a collaboration of NLAAD, the Latino Commission on AIDS in New York City, Care Resource Community Health Center from Miami, Florida, and Orasure Technologies. The presenter today is coming from Ottawa, Canada. Before we continue, a little bit of housekeeping. This webinar is being recorded and is going to be shared with all of you after, as well as we're going to get the presentation and we're going to share a PDF version of it. All those who are not muted by automatic, please silence your mix. And please write your questions in the question and answer section. Do not do it in the chat box because they get lost over there. Okay, this is NLAAD, National Latino AIDS Awareness Day. As I mentioned, we're very excited beginning the campaign this year. This is our 18th year organizing NLAAD in efforts to create awareness among the Hispanic Latinx community about HIV and supporting the ending HIV epidemic plans. We ask you to promote our campaign by posting about it in your social media accounts using the hashtags NLAAD 2020, HIV Fingertips, and NLAAD. Early last month, we launched our NLAAD 2020 campaign. This year, the theme is At Your Fingertips. With this theme, we wanted to remind our community that we have the tools to end this epidemic at the reach of our fingertips. They are in our hands already. That we have easy access to testing, that we have preventive measures that work very effectively, such as PrEP, PEP, and still using the condoms. And also treatment and prevention and the movement U equals U. With all these tools, we can identify those living with HIV who don't know they have it. We can reduce significantly the risk of transmission, and we can prevent new infections. And these posters summarize the message. Unlike other viruses, because we are right now confronting a different pandemic, a new virus like COVID-19, and in this epidemic, it's our fingertips. We already have the tools. We also ask you to visit our website, www.nlaad.org. Browse its information about the campaign and about HIV, but we also like to register your NLAAD event by clicking on the registration link on the page, as you can see in the image. Once you click, it will take you to a different page where you will be able to register your event. Please fill the entire 2 pages, and when you finish, click on the Submit Event. Once you submit your event, And you will receive the registration. We will immediately work in coordinating your HIV tests if you requested them, and your event will be added to our page. If in this picture you can see already some events that have been added. There are more if you were able to browse the website. If you have no plan an NLAAD event this year because of COVID-19 restrictions, we ask you to consider the possibility of doing a virtual event where you can still deliver information about HIV topics that affect your community, creating awareness. We also encourage you that after learning what we're going to learn today about self-testing, you and your organization could get involved in self-testing programs with your local health departments. Finally, before starting today's webinar, I would like to invite you to the following 3 webinars that we're going to have on October 6th at 2 p.m. Social Determinants of Health and HIV in Latinx and Communities of Color with Gregorio Millet from AMFAR. On October 14th, Advancing the Ending the HIV Epidemic Initiative during COVID-19 with Harold Phillips from the Department of Health and Human Services. And on October 22nd at 3 p.m., Undetectable Equals Untransmittable, the message and the movement with 2 ambassadors of U Equals You, Davina D. Corner and Ariana Lind. For today's webinar, Inform and Empower HIV Self-Testing during COVID-19, we have 2 speakers that will present about it. Kyla Coleman from Orasure Technologies and Jairo Farinas from Care Resource Community Health Center from Miami. Kyla Coleman is one of the marketing managers at Orasure Technologies with a specialization in HIV self-testing. While in her role as marketing manager in consumer products, she assisted in changing the perception of HIV self-testing across America. She has worked closely with many partners to launch innovative self-testing programs and takes pride in building unique solutions with partners to achieve their localized goals. Jairo Farinas is one of the supervisors and testers for the Health Promotion Department at Care Resource in Miami, an implementer of the home testing initiative for Care Resource. He plays a role in the backend of the program, handling the submissions, dispatching to counselors, and data collections. So with this, I am going to allow Kyla to share her screen and continue with the webinar. Okay.
Great, thank you. Are you able to see my presentation?
Yes.
Great. All right. Thank you very much for the introduction and for having me participate in today's webinar. As it was said, my name is Kayla Coleman and I am one of the marketing managers for Orasure Technologies. Over the past few years, my focus has been on HIV self-testing and the OraQuick in-home HIV test. I have had the pleasure of working with many local, state level, and national partners to build unique self-testing programs and was honored to be invited to speak today. When COVID-19 pandemic hit, many HIV screening programs grinded to a halt due to social distancing, clinic closures, and public health resources being diverted to work on the pandemic. But as a community, we knew HIV screening could not stop during the pandemic if we were going to reach our goal of ending HIV by 2030. Orasure made a commitment to help organizations figure out how to adapt HIV screening programs to ensure those who needed to test for HIV were able to do so, even during the peak of the pandemic. We wanted to make sure that people and public health organizations were aware of self-testing as a viable option when expanding screening programs or when traditional testing methods are not possible. It is of a critical importance that we continue to adapt HIV prevention services so we can maintain and raise testing numbers. We know program leaders such as yourself have the agility to pivot to new strategies to continue screening efforts. So today I will be giving an overview of HIV self-testing and the OraQuick in-home HIV test. I'm also joined by Jairo from Care Resource, who will give an overview of their program and their experience working with HIV self-testing.
Kyla, I'm sorry to interrupt you. If your microphone is not working well, so maybe you can get closer. Thank you.
Sure, sorry. And if it continues, let me know and I can try some other options.
No, right now it's sounding well.
Okay, good. So with the onset of COVID-19, we saw some unique challenges come to the surface. For example, we now need to consider social distancing guidelines when we're testing for HIV. Self-testing enables us to overcome these challenges without compromising the quality of care. So on the screen, you'll see a couple of benefits of HIV self-testing, and those include that it allows for a completely contactless experience. It supports social distancing and the current quarantine orders. Self-tests can be distributed through the Postal Service and can be used in conjunction with telehealth services. So it allows you to mail a test directly to someone's home or other location, but you can still be present with them during the test through your different telehealth service options, whether it's a video call or a phone call. The currently available self-tests offer a simple, painless procedure for the client and does not require any form of blood. It's a simple oral swab, so once of the upper gum, once of the lower gum, and that is all that is needed in order to do your collection. The currently available HIV self-tests have also received FDA approval, and HIV self-testing is supported by the CDC as an option for those on or starting PrEP. So in the blue bar across the bottom, I have included a quote from the Dear Colleague letter that was released by Dr. McCrae and Dr. Merman of the CDC on May 15th of this year. The quote reads, "Although this type of HIV self-test is not usually recommended for PrEP patients, clinicians should consider using these tests when other options are not available." I've also included a link to the full letter. If you have not had the opportunity to see it yet, it can be found on the CDC website. On this slide, you'll see a few more details about the OraQuick in-home HIV test. So as mentioned previously, the OraQuick in-home HIV test is the first and the only FDA-approved self-test for HIV available in the United States. And when I say self-test, the OraQuick in-home HIV test is the only true self-test available. And what I mean by that is you get the test, you do the test at home, you do the sample collection at home, and you get your results there as well. There is no need for you to send a sample type out to a lab for processing. You get your results privately in just 20 minutes. The instructions and all included materials come in English and Spanish. It is the same test device that has been used by public health and healthcare professionals for decades. And as I mentioned before, it is optimal for web-based client interactions such as telehealth. So I did mention both the use of video conferencing and telephone calls. We've seen partnering organizations do both scenarios, and the instructions are very simple. So while an individual can navigate the way through the test themselves, there is the option to have someone from your organization available, whether through texting, a phone call, or video conferencing during the test or immediately after. We also offer a 24/7 support line available to clients in English and Spanish if they have any questions about testing for HIV, about the actual test, or about the next steps that they should be following. And finally, the OraQuick in-home HIV test comes with a discreet disposal bag that fits everything in once you've completed the test, and it can be thrown away in your regular household trash. So I've only got a few more slides before handing things over to Jairo to hear his firsthand experience working with HIV self-testing, but I wanted to include some of our frequently asked questions about the test first. So the accuracy of the tests, of course, this is a very common question. The OraQuick in-home HIV test is the same test that has been used by public health and healthcare organizations for decades. In studies, the self-test detects 91.7% of people who were infected with HIV and 99.9% of people who were not infected. Now, you may notice this is different performance data from our professionally used test, and that is due to the fact that we used lay users to conduct their own test during the clinical trials for the self-test. Another common question we get is around temperatures affecting the test. So oftentimes we get this question from organizations who are located in areas with extreme heat or extreme cold. So we have had programs run self-testing events outside or even mailing tests in very harsh environments, and we've had no issues reported that the temperature affect the test. A perfect example of this is some of the programs that are being done in locations like rural Arizona, where they are mailing the test kits and they could potentially be sitting in a mailbox in temperatures upward of 100 for a couple of hours in the afternoon. But like I said, there have been no issues reported with the temperatures affecting the test. And finally, one of our other FAQs is how much does the kit cost? So public health entities are extended pricing of $28 per kit. We also offer different distribution models. If your organization is interested in leveraging OraSure's shipping capabilities, we can set up a program where we would handle mailing individual kits out to clients for you. So the pricing for the distribution models is dependent on the type of program selected, but your local representative can provide examples and pricing if you're interested in further exploring this option. And with that, here is your list of local reps. So we take pride in the fact that our public health team is made up of public health professionals who have each worked as a leader in the field of HIV or STI prevention and can be a valuable partner to you. So I've got a list on the screen of each team member by state. You are free to contact them today with any questions or if you'd like more information after today's webinar. But you're also available, you also have www.orasure.com/relief available to you if you'd like to request additional information, support, or you're unsure of which rep to contact. I'd just once again like to thank the Latino Commission on AIDS for inviting OraSure to participate in what I'm sure is going to be an amazing webinar series. I will stay on the line to answer any questions you may have, but in the meantime, it is my pleasure to introduce Jaro from Care Resource in Florida, who will give an overview of their work and provide insight from their programs.
All right, everybody. Thank you, Kayla. Let me just set up my my screen share here. Give me 1 second. Okay. All right. Hopefully, everyone can see my screen here. All righty. So, my name is Jairo Farinas. As mentioned, I'm one of the supervisors here at Care Resource. Before I begin, I just wanted to give a quick little overview of Care Resource. So, we're based here in Miami, Florida. We are a 501c nonprofit organization, and we're an FQAC serving, as mentioned earlier, Miami-Dade and Broward counties, so South Florida. We provide services such as HIV and STI testing for free, general medical services, case management, dental, pediatrics, and behavioral health services. So I guess I'll get straight to the point regarding the home testing. So I'm pretty sure almost every testing organization has been affected by COVID. I'm pretty sure no one has been left unscathed. I remember back in March when everything kind of just started, I actually got hit by COVID and I was out for about a month. Thankfully, I said I have a very supportive team here at Care Resource. My boss had asked me during the time that I was home to come up with at least a blueprint, something for the home testing program. So basically, what I'm gonna show you now is kind of what we, it's kind of a little idea of to give everybody basically the home testing program. All right, so basically I'm going to go over the overview of the process. I'm also going to show the website that we have set up for clients who do want to sign up for the service, and then as well towards the end I will answer questions. But yeah, so to start, so the first thing that happens, let's say if a client is interested in getting the home test. First off, they have to go to the website, which is seen there, careresource.org/home testing. As mentioned, I'm going to show that to everybody once I'm done with this slide. Once they put in their information, once they submit and sign, the administrator, the person who works in the back end, will receive a notification and basically logs into a secure server to access it, and then from there give it to a counselor so they can work on the client. Let me quickly jump out of here so I can show everyone the website. So let me see if I can zoom in a little bit for anybody who's on mobile right now. So yeah, so this is our main website that has a home testing program link, that has a link on here going on here to testing. And basically here, if you're a client, It basically describes the program in detail, to fill out the request form, what to expect regarding the wait time for a counselor to get to you if necessary, and then basically the options of delivery, which I will get to a little bit later. And then this is the form that the clients fill out. Very basic, very simple. Nothing too, excuse me, nothing too, I guess, like it's not going to ask for birth, sex, or for gender identity or anything like that. That's going to be later on for the pre-test. And then from here, all the information that they need, and they can sign right over here, and then just submit. Very simple. So let's go back here. All right, so that's the first half of the process, basically the client signing up to the service. Next up over here is the pre-test portion. So what happens here is that the counselor, again, from myself, they receive the submission of the client and then contacts them by phone to start the session. Obviously, the session is treated just as if it's in a office setting, so the session is confidential. We actually ask clients to be in an area where no one's around, where they feel comfortable talking about confidential information, such as their date of birth, sex partners, all that stuff. And then from there, once everything's situated, the counselor then begins their questionnaires, the System 28 here in Florida that we use, to ask about risk factor questionnaires and any other documentation that's needed. That takes about 5 to 10, at the absolute most 15 minutes. If there's a lot of questions or a lot of concerns the client has. And then from there, once the pre-test is done, the client and counselor then talk and agree on a day in which the home test can be, that the client can receive the home test. Again, I'm gonna elaborate a little bit on that piece a little bit later down the slides. Then from there, once the client actually receives the test kit, they essentially do the test at their earliest convenience. It could be the same day they get it, or maybe they want to wait a day or two to have the house themselves and do it, whatever makes them comfortable. And as Kayla explained, the home test kit, again, it's I don't know if anyone has ever seen or used it. It's, again, a big box, looks like a clamshell. It has a lot of information. It's, it takes some time to read it, but for anybody who's new to it, they read it. It clearly explains what you have to do, what you don't do, all that stuff. But just in case, if for whatever reason the client doesn't understand it, or is a little hesitant, or just needs a little assurance, they can always call up their counselor at any point if they need help with the test kit. And then after let's say after the pre-test, after the client does the testing, then the client calls back the counselor to do their post-test, right? So most of the time, the test will come out negative. So if that's the case, then the counselor continues with their normal post-test counseling education, and also any recommendations of referrals or services based off their pre-test conversations, risk factors, client inquiries, anything like that. So let's say the client is, has a high risk factor for like sex partners or is MSM, we can refer them to PrEP. And the good thing, and then obviously with COVID, if your agency or any of the agency you work with has telehealth services, they can do PrEP over telehealth, so the client never actually has to come to the office and risk getting COVID if that's their fear. And then also as well, they need behavioral health, medical, anything along those lines. That's where generally the process is where you have to file that. And then in the off chance, if there is a reactive test, we do try to get the client to come into the office, and we do the finger stick version of the OraQuick test. Just because there could always be possibilities of a false positive. It can always happen. Could be the client may have drank something within 10 minutes of doing the test, might have eaten something, might have smoked something that could have definitely affected the test, or they waited 50 an hour, 2 hours after the actual test was done, which is supposed to really be between 20 and 40 minutes. All those things kind of play a factor. So just to kind of rule that out, we do the test again as a finger stick this time to reduce all of those confounding variables. And then if it comes out negative, for anybody who's high risk, such as multiple sex partners, inconsistent condom use, ingestion drug users, high risk individuals, we do run a fourth generation test on top of it just to be sure, because it could also be an acute infection possibly. We can't rule that out, obviously. And then if either the fourth generation or the finger stick comes out positive, then we refer them to our test and treat program, which, as you may know already, or if your agencies offer it, test and treat is the program that the same day they test reactive for HIV, they see the doctor the same day, if not next day, to get started the treatment, again, same day or next day. So going back to the delivery method, as I mentioned earlier, so one of the things that I thought about was access to these to the tests. And obviously not everyone has vehicles, or COVID kind of makes people not want to drive back and forth or anything like that. So we came up with 3 different methods of delivery. So the first one, which is by far the most used one, and by far mean over 90% of people prefer this, is that the counselor delivers a test to the client's residence. So basically, if a client lives in XYZ Southwest First Street, obviously the counselor drives there, doesn't necessarily go to walks up to their house, doesn't do that. They stay in their vehicle, the client comes outside. Obviously the counselor verifies them before giving them the test. And then basically they just pick it up from the car and they go back home, and the counselor continues on to the next delivery. The second option, this is optional for the clients as well. They prefer to come up to the office and pick up a test. They can do that as well. It just has to be orchestrated between the counselor, the person who's here at the office, and also the client, just to make sure we're not giving it to the wrong person. And then the last one is shipping. So here in Miami-Dade and in Broward, Miami-Dade is a pretty big county. It goes from around the Miami area, and about 30 miles south is where the end of Miami-Dade is. So if anyone's familiar with Miami-Dade, you have Miami on, I'm trying to think, it's the north end of things almost, and then Homestead is like 20, 30 miles down south. Obviously, that's still part of our service area, but it might be, a little too far for a counselor to drive up to. So we do offer the shipping method in that case for clients using the website that's only unique to Florida. Regardless of the method, the package, or in this case, if it's going to be shipped, an email, will have a paper that has the counselor's information, such as a phone number, email address, and callback instructions once the client is done with their test. And then again, that's basically, if they have any questions or anything like that, they can call through using that. Next slide over here. So this is some numbers that I managed to get starting, I think, when we started the program, I think it was April that we did the pilot, and then May, June, July, or August. I'm sorry, I'm trying to remember when was the time that we officially rolled out. I think it was April or May. But either way, the total tests we've done so far, not including this month yet, because we're still running numbers for this month, we have done over 478 tests. I did manage to get age, race demographics, and ethnicity demographics. By far, the demographic that, and especially when it comes to age, is 18 to 29. This is pretty self-explanatory, because we all, us in that age range, we like to use our phones. We don't like to go out too much, but also explained as well, COVID doesn't allow us to go out or anything like that. But 18 to 29 is by far the demographic that is using this program the most. In regards to race, again, white and black, 51-46%. Ethnicity is basically almost even. And then I also have a number here of anyone who is their first time testing, if they're new clients of Care Resource, so not necessarily first timers, just new clients of Care Resource, and any clients that are self-referred. So first timers. So in regarding the first timers, new clients, this is obviously self-reported by the client, so there's a little caveat there, but we have it there anyways. Self-referral. So actually, let me talk about that in the next slide, because I think it's coming up right now. Okay, so let me get to this part, and then I'll explain that last piece. So rolling the program. So as I mentioned, when the program was developed around March, early April. We came up with the blueprint, we came up with the protocols, the policy, all the 9 yards essentially. First off, let's start with the pilot, which is definitely if your agency does want to start the home testing program. Obviously, you're going to go through a pilot. You don't want to go full scale and then find out there's a lot of kinks, a lot of little errors or big errors that then become a snowball if it's not taken care of. So for the pilot phase, I started the pilot phase, did it with a few friends that are okay with me, doing testing, or any agency clients that are regulars that they know pretty well here. Start there. Then from there, as I mentioned earlier, the implementation procedures to make sure that what's explained in the policy or in the procedures is going as planned, and basically just ironing kinks and fine tuning it more or less. Early phase for us, I think it was the month afterwards. I think that was May, if not June. I keep forgetting. I always confuse the months, but I think it's May. Once everything looks like it's working well, we pulled a history of clients that tested with us in the year 2019. If your agency can do that, do it. Basically, let's say a counselor for 2019 had 100, just an example, had 100 clients that they tested in 2019. They get that list, and basically is to outreach to them, calling them and saying, hey, we understand COVID has affected your ability to get tested. We're offering this service, would you like to take part of it? And that's how you kind of start at least getting some clients into for the program to kind of get it rolling. We also printed out palm cards, which I think one showed up here in the website. Right here. Oh, I'm sorry, everybody. It was too close. So I don't know if anyone can see my mouse. This is an example of one of the palm cards that we can give out. Okay. So those we hand out to any of the any of the office clients that come in, so they can give it out, learn about it, maybe test on it their next time in the next 3 or 6 months, or just clients of generally of the agency. So I'm sorry about that. Let me go back here. And then from there, we also did create the phone support line. So you did see that it had a phone number on there. We did create that just in case if any prospective clients that wanted to do the home testing had questions beforehand. They can call one of those 2 numbers. One number is for Miami-Dade, one number is for Broward. This is very useful, again, just in case if they have any questions, they might be afraid of committing or just want to get some clarification beforehand. It's always good to have that line there. And then once everything is looking good there, then basically from there it's just expanding the program, which from there, it really depends on how creative you can be or how many different connections. So for example, community partners, so let's say any organization that you do testing at, so let's say it might be a library or another center that allows you to do testing in in their office that you can't do now. You might be able to reach out to them. So for example, we had recently started doing once a month at a oh my god, I forgot the name of it. Principles. Okay, so it's a recovery center. That basically we would hand them the tests the day before. They would have their session in the next morning, and then from there we orchestrate with them for the clients to come in, have the room to themselves, and do essentially a Zoom conference call only with the counselor and the client. Yeah, to basically do a test right then and there. It's a little bit different, but again, that's one of the things that we're trying to do right now to try to expand this initiative. Also as well, when it comes to just general outreach, if you have good connections with a university or a college, definitely reach out to them and give them the electronic banners so they can post, so they can promote it on their social media, their email broadcasts, et cetera, et cetera. And also as well, a third one that, just to give you an example, any clients that, let's say, a counselor may have had, they would then ask the client, if they have any friends or family members, they can tell them, right now or maybe a day or two afterwards once they're done about the program to see if they want to do the test. And so far, that's also had some success as well with our counselors, just asking the client if they have family or friends at the moment that they can refer them to. I think that's it. Let me just double check. I think I'm supposed to talk about the self-refer. So this is so as I mentioned about the self-refer. The reason why I put that there is because most of our clients, at least at the beginning, was clients that counselors called out to outreach. Self-referred would be anybody who, let's say, doesn't have a referral name from a counselor or anything like that, that just on their own signed up for the program and wanted to get tested. Let me double check if I have everything here. Oh, and regarding the what's it called? The post-test, ¿cómo se llama? My mind's very lost right now. When it comes to the referrals and everything like that, as mentioned, we not only, like I said, prep, we can do telehealth, but also as well, let's say if the client, just needed general medical, not necessarily prep or anything like that. They obviously do have to register, but normally pre-COVID registration would happen in the office, but because of COVID, can't do that obviously, because we don't want to risk a spread or anything like that. So no, also as well on the website, we also do registrations online. Let me see if I can show everybody here. And again, these are all things, tools to have to increase the access to reduce barriers for clients. So as mentioned earlier, this is the website for the home testing program. And then over here, pre-register. So let's say if a client, is interested in prep, but doesn't want to come to the office to do any paperwork or to see a doctor, the counselor can refer them here to the patient registration form. And it almost looks similar to the previous one, but this is obviously asking more specific items here. And then what happens is that once they finish this up here, once they sign and submit, another department, another team calls them up, finishes up the registration, and basically, schedules them for the visit that they want. And I think that's it off the top of my head. Again, this is just a quick little overview. Obviously, I will be here to answer any questions anybody has. I will try my best to answer those questions. I know that there's a lot of different policies and whatnot depending on what part of the country you're in. And yeah, that's it. I'll be here for your questions. Thank you.
Okay, thank you, Kyla, and thank you, Jairo, for this information. We have plenty of questions here in the question and answer. I don't know which one of you two can answer this question from Michelle Sevilla. Is the CDC allowing CDC funded grants to purchase in-home tests?
So I can speak to that a little bit. So it depends on the grant as well as your location. So we always suggest looking into your specific funding that you're receiving. But generally, yes, CDC funding can be used to purchase self-tests.
There's a question from Marcos Q. Sarmiento. Can the OraQuick test be sent to other countries such as Mexico?
So we do have an international version of the test. The one that we talked about today, the OraQuick in-home test, this is solely for use in the US. But if you are interested in looking at tests for other countries, contact us and we can work with you to see if we have a solution for that.
A question from Victor Martinez. He says, what about confirmatory tests? How is it conducted?
Okay, so confirmatory testing, this is the fourth generation thing that I explained earlier. So this is, again, let's say if the home test at home came out reactive, again, we don't know what variables might have accounted for that. Could this person have drank water, smoked something, whatever the case is. Again, we have them come to the office. We do the OraQuick finger stick there. And then in the event if we need to do, again, a confirmatory, in this case, a fourth generation, we do it then and there. Let me make sure if I think that was the question.
Thanks to add, that's fine. Okay. So
Sorry.
Lourdes Conde says, are the tests covered by any insurance?
You want to take that, Kayla?
Yes, thank you. No, currently I do not believe the tests are covered by any insurance.
Lisa Walden, what are some common issues for the home users that contributed to the data accuracy?
Sure, maybe I can start this one, and then Jairo, if you have anything to add, please do. Actually, Jairo had just said, sometimes people will smoke or use dental care or oral care products right before doing the test. There are instructions that tell you a certain amount of time before doing the test, since doing those activities. One of the other issues may be people believe that the more sample they collect, the more oral fluid they get on the device, the better the results are going to be. And that is not true. You can actually oversaturate the device and cause issues in the performance. So we just always recommend to make sure you instruct individuals to read the instructions, read the box. If they're following the directions, there should be no issues.
Okay. No, I have nothing else to add. Actually, the next two questions, I was going to try to answer those two at the same time.
Yeah, I think they're for you.
Yeah, the Irvine and the Christina one. Yeah, so the next question here is from Irvine. I hope I pronounced your name correctly. Please share how client signature is set up on the site. And then Christina is talking about the Section 28 form and how to use and using it for the at-home testing, I think it is. So read it here. In the state of Florida, we can use the Section 28 form. Do the digital agreement form count as a consent form? Okay, so then you answer the first question. I'm gonna have to share my screen again on here.
Good.
Okay, bring this down. Let me go back. Okay, so the signature piece over here, let me double check to make sure, because I don't want to make sure I'm not answering the wrong question. Basically, yeah. Okay. Yeah. I'm trying to make sure, I'm trying to find the question. There we go. I'm sorry. I need to read it because, okay. Yeah, so basically, again, once the client it finishes up their form here, they accept both here. They accept and agree, sign, and then they submit. The second question regarding Section 28. Yes. So before we actually even did the pilot, we did have to speak with our Department of Health here. We showed them all of our procedures to make sure that everything is accordance to what they're looking for, but also as well what constitutes consent to get tested. Obviously, that's very important. Normally, if you come to the office, they have, we tell them what it is we need to do. They sign off on it. They date on it. Obviously, you can't do that if they're not at the office. So that's what this piece over here is for. The term and conditions. We also have the record use and release consent, the client's rights, responsibilities, and grievance procedures. Once we showed them this, they reviewed it and they okayed it. So what we do is in the chart that we create for the client, what comes in the back end, that gets printed out and put in the client's file, and that would be essentially the consent for testing. Okay. Hold on. Your mic. There you go.
Okay, there's another question. I think it might be for Jairo, that runs programs. How do you perform STI testing, creatine testing without the client coming to the office? It's required in my state to get approval for medication assistance program.
So I think they're referring to PrEP, if I'm mistaken. Hold on, leave the question there. I would like to read it whenever I'm answering it. So yeah, so I think they're referring to PrEP because that does STI testing and creatine testing, or creatinine testing. I keep forgetting which it is. So once they, give me 1 second. Once they get registered, once they have an appointment with the doctor to telehealth, obviously lab tests have to be done in office. So they can schedule a day where they can come to the office to do just labs. So basically go in and out. If I'm not mistaken, I think they do have an option of going to, let's say the client's insurance only accepts Quest Diagnostics as a laboratory of choice. If I'm not mistaken, I think they could be able to go to a Quest Diagnostics laboratory near them, and do it there. So yeah, it's so obviously that's still, obviously you can't do prep labs without being at a laboratory. But yeah, so to answer the question, they can either come here, but again, it's going to be more of an in and out situation, obviously following COVID protocols, 6-foot distance, wearing a mask all the time, etc. I guess I'll answer the next one. I see here from Maria Gutierrez, do test counselors use their own vehicles? Yes, they do. And one thing that is very important to consider, especially when it comes to an agency perspective, is mileage reimbursement. So definitely have that set up with your agency.
The next one is for you too.
Yeah, I'll just name them back. So is your self-testing program also offering in-state blood sticks or just oral swabs? So for the self-testing program, it has to be an oral swab. NST is almost every other test, I think, is a blood sample, which the thing is, clients can possibly do a finger stick, but if we can only provide one, maybe two of those little things. And also as well, it does require some experience to use those. Yeah, that's why we're using the OraQuick system, just because of its versatility. Not only can you do it through a finger stick, but also orally. It just reduces the possibility of a client, making any technical errors, and then it becomes an issue if they have to get another test. And yeah, it's what's the next question?
This one is, who or what agency is the one that collects all this data? Who really is HIV coordinated entry? I think that's the CDC, right?
Probably.
Yeah.
Who or what agency is the one who collects all this data? All this data. I don't know if they're referring to the data that I presented, because if that's the case, that's internal. That's basically the information that I get for what the clients. So for example, right here, ethnicity, race, we get it from there. But again, I don't know if they're referring to the CDC side of things or the things that I presented. I'm not 100% sure.
Yeah. The question is not very clear.
Okay.
Hopefully, the person will write it again.
Okay.
So the next question is for reactive clients, who do you perform partner services? How do you perform partner services if a patient does not want to return to follow up?
Yeah. So the partner services, I'm thinking the Department of Health because I know the Department of Health offers its partner services. Hold on, can you pull up the question again? Oh, I think it's under answered, I think.
Yeah.
Give me 1 second. How do you perform partner service if a clinician does not or cannot want to come in for follow-up? Okay. So yeah, thankfully that hasn't happened yet, but I know that is something that we try to plan for. So normally when a client, has if they do have a reactive rapid oral test, obviously we try our best to have them come into the office so we can do their HIV test, and again, if necessary, the 4th gen. It's a tough one because obviously we can't force clients. Obviously, it's their free will. We can't force them to come in and get tested. Then from there, I would think I wouldn't think the Department of Health then of our county would follow up with them. We try to follow up as much as we can, but thankfully, like I said, it hasn't happened yet here. But yeah, we can't force clients to come in. Yeah, it's a tough question, I will say, but the way I would answer it is, we can't force them. We can't force them. If anything, obviously, the Department of Health would follow up with them afterwards.
What about if we are planning to a drive-through event where clients are just picking up a test kit?
That is a possible alternative if your agency does want to do that. We couldn't do it here because the building we're in doesn't really have that much space a drive-through type scenario, but it definitely is doable. I actually have heard of it in different parts of the country with success. Obviously, you need a good enough parking lot so that people can park. You can walk up to them, get the information, pass the test, and have them do it right then and there, in front of right there on the spot. It's doable. I guess it depends on logistics at that point. But yes, it is definitely doable. If you usually can do it, do it. On top
Nice.
of any other options that you can do.
I'll just add to that quickly. So we've seen, the audio is sounding better because I received a few comments. It was coming in and out again, but the really unique thing about working with the HIV self-testing kits is that you can create such a localized program depending on what your community needs. So we've seen organizations set up a pickup location exactly like what was just explained, where you drive up, you share your information, and you leave with a test. We've also seen places where, maybe they send you a survey to collect your information beforehand, then issue you a time to come by the location to pick up the test. So it's a very flexible thing to work with. So there are many different options. If you're looking at different scenarios for your local need, you can usually shape a self-testing program to fit whatever that need requires.
Thank you. I think the next question is for me. Did you send the attendees samples of the testing kits? Our clinic received 4 boxes containing 6 kits per box today. I wasn't sure if it was part of the joining the webinar. No, it's not part of joining the webinar. Probably somebody in your organization has registered an event and requested support with HIV testing, and we already coordinated that, and you just received it. That's what it was.
Okay. Next question, any STI testing being done? For home test, obviously not. I wish there was a rapid test for it, but there's no rapid test for chlamydia gonorrhea that I'm aware of. But no. But we are doing STI testing in office. Obviously, most likely other agencies are doing that as well. And just a heads up as well, I know this is kind of off topic, but if anyone, I don't know if anybody has been experiencing this. I know we've been experiencing it here in our office. If your agency is doing swabs for chlamydia and gonorrhea, there has been delays with those results coming in, just because, for example, Quest and maybe even LabCorp obviously have the COVID testing swabs as priority. So just so again, it's not part of this, but I definitely noticed that there is a delay in those results coming in for STI swabs. Just a heads up on that. Next one, so we don't have to run monthly controls on tests. Kayla, for the home test, there's really no controls that can be run, correct?
Correct, yeah. There's no requirement to run controls on the tickets. Basically, when your client gets this, or when your organization gets a case of these, they're ready to go and to be sent out to be used.
Okay. The next one here, what has been your experience with clients testing positive and looking to care? So, there were a small handful of not a small handful, it's only like 1 or 2, if I'm not mistaken, of false positives. Thankfully, they were false positives, but we will treat them just in case as a positive, come bringing them in and having them do the test. So the experience with that is, again, this is according to our counselors here at the office. Clients are understandably a little worried. They call, they also actually send a picture just to show proof, like, hey, showing up here, what does this mean? This looks like, can you tell me if yes or no? Clients are pretty cooperative regarding coming into the office to do the finger stick and the 4th generation if necessary. They've been pretty cooperative with it. It really also does matter how the counselor obviously sounds over the phone, if they're caring, if they have that empathy. That also does make the experience better, and the client's much more cooperative in that case. But that's basically from what my counselors are saying, that the experience is, again, mostly cooperative. People do care about their health and their sexual health and want to get to the bottom of it. Something were to be wrong, that they want to know what it is. Next question, do you follow up when a client does not call you back? Yes. So there are definitely times where, let's say, I give a counselor, I give a counselor to a client, to start to contact them to do the pre-test. Obviously, clients may not respond. Maybe they're busy at work, they have their phone away, or whatever the case is. We try to call, if I'm not mistaken, I think it's at the very minimum 3 times. If by the 3rd time they do not answer, then we can't be following them all the time, obviously. We try to leave them voicemails, obviously as vague as possible, so as not to identify that, hey, is an HIV test person. Obviously not like that, but we try to leave as vague as possible to remind them, hey, we gave you a call, please give us a call back at this number. When it comes to, let's say they have the test itself and we haven't heard from them a day or two later, or over 2 days, I'm sorry, for the results, then the counselor does call them back, just to follow up with them to make sure, they're okay, they've just been busy, if they have any questions about doing the test or anything like that. Let's see. I already mentioned the knowyourstatus.com website. Stop it. Do I understand there's only one in my area? One more time. Did I understand that's only my? Okay, so the website that I showed you, the knowyourhivstatus.com website. So that one, when you click on it, or you can find it in Google and click on it. That one, when I read through it, it's only says the state of Florida. Not sure if other states have this. You would have to check with your state on this, but it's not unique to Miami. So let's say if somebody's outside of our service area, so our service area is Miami-Dade and Broward County. I've had a few inputs where one was from Tampa, one was from I think it's Palm Beach County, and I keep forgetting what the other county is. They can utilize that if they want to. But yeah, but it does work in Florida. Just it's not only Miami. How old do you have to be to request a test? Kayla, I think 17 and up, correct, is the age that they can a client can test?
Yeah, see, you could do this without me, Jairo. Yes, so the age on the box is 17 and older, and we've seen different programs do different age limitations depending on their target audience. So, for example, some organizations have opened it up statewide to anyone who wants an HIV test, but we've also seen programs that do more targeted approaches. For example, if you were trying to get first-time testers over the age of 25, the programs could put their own limitations in place. But for the test device, the youngest age is 17.
Yes, 17. I think the 1, 2, or 3 that were on my data sets, I think there were actually at 17 years old. Anyone younger than that, I would either recommend them come to the office to do testing or do it with their pediatrician or doctor. Just because, again, with Orasure technologies, if they say 17, we're just going to go by that. We don't want to have any sort of confounding variable or anything like that, let's just say. What languages are the instructions available in? Kayla?
Yep, so everything, including all of the text on the outside of the box, the instructions, and the educational information inside the box come in English and Spanish. Our website is also available in English and Spanish, and our 24/7 support line, our operators are fluent in English and Spanish as well.
Okay. Will the CDC count the test if the tester did the test? I might have missed it. Or are the participants obligated to submit the results? So part of so when the client actually submits their form, let me bring up one more time. But anybody at home or on a computer, you can definitely go on the careresource.org/home testing website if they want to read it more thoroughly. But give me 1 second. Okay. Yeah. So as part of the terms and conditions, we definitely try to ask clients, to be honest, that they'll report the results honestly. Again, obviously, we're not gonna force them or hold their hand to the feet to the fire or anything like that. They don't want to report it or anything like that. But yeah, so basically they're not 100% obligated because again, yeah, they agree to the term conditions, but we're not gonna force them or anything like that. Obviously, they do have the right to at any time, rescind their participation from the testing processes down here. So just like with an HIV test at the office, if let's say they do the test and then all of a sudden they don't want to be there, they want to leave, whatever the case is, you know, they have the right to do that. Are positive test results shared with the DOH CDC? I think this is a law requirement, if I'm not mistaken. That reportable diseases such as chlamydia, gonorrhea, HIV is a reportable disease. So I think that's a yes. Correct me if I'm wrong. Oh, hold on, you're mute. You're on mute. You're on mute. You're on mute.
Oops, sorry. I think you're right. It's by law reportable, but it depends on every state and city which have different regulations on how to do that. It is already past 4. I'm sorry. We have 1 hour for this webinar. Thank you, Kyla, and thank you, Jairo, for all this information that you have shared with us. And thank you for everybody for their participation and so many questions and comments. It was a very nice webinar with a lot of participation. So thank you, and I'll see you hopefully in the next webinar. Bye-bye.
All right, thank you.